Once we move forward with Tommy John surgery, the recovery again is of paramount importance, but what we're really focused on is when can we get our patients and our athletes back out on the field and playing. And so the first 2 to 3 months are dedicated to protecting the repair, allowing the soft tissues to heal, regaining full range of motion and strength. And then at around 3 months, we'll start incorporating some throwing programs, exercises, and focus on mechanics. Around 5 to 6 months, more significant and aggressive throwing programs, and return in full around, on average, 12 to 13 months to about the same level or better than they were prior to surgery. For the ulnar collateral ligament repair, that timeline is sped up a little bit, and on average we're able to move forward with a more significant throwing program at around the 3 to 4 month mark and full clearance without restriction at around 5 to 6 months.